dividing into two sections, part 1 and part 2. Part 1 will include the hormones and histology and their negative feedback loops from the pituitary gland, from the thyroid, and parathyroid glands. So starting at the top, which this chart is representing brain level would be, your hypothalamus, but more importantly, your pituitary gland. You have an anterior pituitary and a posterior pituitary. The two things or two substances or hormones are stored and secreted from the posterior pituitary. That would be oxytocin and antidiuretic. And from the anterior pituitary, we have 6 hormones. We have FSH, LH, prolactin, ACTH, HGH, and TSH. Now, the ones associated with reproduction, we're going to look at it in more detail when we get to the reproductive system. So we're not going to really look at it in any detail, oxytocin or FSH, LH, prolactin, but we will look at now and when we cover the urinary system, antidiuretic. And then we're going to look at TSH, HGH, and ACTH. So we not only have this board here, but we have the little naked dude on a plate with his thyroid, and remember the thymus gland. When we cover the second part, we'll come back to adrenal glands and the pancreas. But for now, we're just going to do it in the upper region. Okay, so we have, from the brain, we have antidiuretic. Antidiuretic targets the kidneys to reabsorb water. The negative feedback loops you're going to fill out on the on your exercises for the lab handouts you were given. But essentially, when you have low blood volume, low blood pressure, you're going to secrete antidiuretic that targets the kidneys to reabsorb water, therefore increase blood volume and increase blood pressure. Oxytocin we'll come back to in reproduction. Anterior pituitary, and adrenocorticotropic hormone. Adrenocorticotropic hormone targets the adrenal cortex. So again, the loop is in there, but when you have decreased amounts of cortisol, essentially, ACTH will stimulate the adrenal cortex, and the primary hormone that's elevated is going to be cortisol. And so when we get to the adrenal gland, we'll look at exactly what cortisol does. Then we have human growth hormone. Human growth hormone targets general body cells. Frequently, when someone is pointing to this inner, middle region here, they're referring to general body cells. And human growth hormone is one of those hormones that targets multiple areas of the body, especially bone and muscle tissue, to increase protein synthesis and cellular repair. So when your HGH levels are low, targets general body cells to increase your protein synthesis and metabolism, mitotic rates, not metabolism so much, let's keep that for T3, T4, but it'll increase your mitosis rate. So HGH is really about repairing tissues, that get utilized, day in, day out, versus what affects metabolism. That's really a little bit different. Okay, then the last hormone produced and secreted from the anterior pituitary will be thyroid stimulating hormone. So thyroid stimulating hormone targets specific cells in the thyroid gland. Those are your follicular cells there, and they secrete T3, T4. So when you have low levels of T3, T4, we secrete thyroid stimulating hormone, which targets the follicular cells of the thyroid gland, and they release more T3, T4. Okay, then we're going to go to the thyroid versus parathyroid glands. So we just said that the thyroid gland is actually going to produce 2 different hormones from cells, either follicular or parafollicular cells. And we'll look at these with the slides in just a moment. So the follicular cells are the cells that surround a follicle. They secrete T3, T4. So when you have the stimulus, I should say, for the release of T3, T4 will be thyroid stimulating hormone from the anterior pituitary. That stimulates the follicular cells to secrete more T3, T4. T3, T4 targets general body cells to increase the metabolic rate, or your basal metabolic rate, which means how efficiently you convert molecules such as glucose to ATP. Okay, so that will increase ultimately, and then you have an increased metabolic rate. The other cells here, the parafollicular cells and the thyroid gland here, are really from A&P1. This is about blood calcium regulation. So when you have higher than normal blood calcium regulation, the parafollicular cells, which are cells in clusters and in kind of a mass found between follicles of the thyroid gland, they secrete calcitonin, and calcitonin targets osteoclasts to inhibit them, and therefore allow more calcium to be secreted, out in the urine, and you decrease blood calcium levels. At the same time, you can stimulate osteoblasts as well, because when you have extra calcium, now's a good time to store as much calcium to fortify bones for later. So you would inhibit an osteoclast and possibly stimulate an osteoblast. Decrease blood calcium levels as a consequence, or normal blood calcium levels. Here in the parathyroid gland, since parathyroid gland only produces one hormone, it produces parathyroid hormone. The stimulus for its release is going to be lower than normal blood calcium levels. So when you have that kind of a scenario, parathyroid hormone is going to have multiple targets. First, it's going to target your osteoclasts in bone, and this time you're going to stimulate them to break down compact bone, or some regions of it, and liberate that calcium into the bloodstream, and thereby elevating blood calcium levels. But it's also going to target the kidneys. The kidneys will reabsorb more calcium as you're developing urine there, creating urine. At the kidney level, we also convert that important vitamin D to calcitriol, and calcitriol targets the small intestine to increase absorption of calcium from it as food transits through it, and thus from these multiple sources increase blood calcium levels. So now we're going to go and look at slides. So if you want to halt that, I'll turn on the lights or turn off the hypophysis or the pituitary gland. You have two regions, an anterior pituitary and a posterior pituitary. The anterior pituitary is formed from glandular tissue of the throat as you're developing embryologically in your mother's uterus. This is glandular tissue that gets pulled upward into the cranial cavity, and thus it has this very grainy appearance. Right, so you can see all these little individual cells here, darker staining generally, and when I go up in magnification, you'll see the difference for sure. Over here is the posterior pituitary, and above it there, it has that pale staining, stringy kind of an appearance, because posterior pituitary is actually neural tissue from the area of the hypothalamus that gets drugged downward. And that, therefore, then twists off, so to speak, and it forms the anterior and posterior pituitary glands, respectively. Posterior pituitary is neural tissue, so they don't have the capability of making hormones, but they can store and release hormones from the posterior pituitary. So one of the best differentials for distinguishing between anterior and posterior pituitary visually, is just looking at a grainy appearance versus a pale, staining, stringy appearance. So let me increase my magnification. Let's go up here a little bit. Yeah, it's a little better. Okay. So to the right, you can see now that you have all these independent little cells. There's actually quite a few basophils found here, believe it or not. So from here, we have a total of 6 hormones that are produced and released. We're only looking at 3: human growth hormone, adrenocorticotropic hormone, and thyroid stimulating hormone from the anterior pituitary. Stored and released from the posterior pituitary, pale staining appearance, will be 2 hormones, oxytocin and antidiuretic. We're just really going to be looking at antidiuretic right now. So you should be able to apply any of these negative feedback loops that you've learned and filled out in the lab exercise, apply them to the slides as well. So let me give you an example of a question someone could ask you. First of all, they could just ask you, identify this specific gland, and you would say anterior pituitary, or this specific gland, posterior pituitary. Or then I'd say, what 3 hormones or what hormones are released from here, formed and released from here. And so you would say TSH, thyroid stimulating hormone, human growth hormone, adrenocorticotropic hormone. Or from here, what hormone might be stored and released. You could say oxytocin or antidiuretic. Or you could ask a question such as, what hormone from this region targets general body cells to increase protein synthesis and mitosis? You would say human growth hormone. Maybe from here, we could say, identify the hormone here that targets the kidneys to reabsorb water, increase blood volume, blood pressure. Then you would say antidiuretic. So I would know specifically what comes from here and what's the stimulus for the release, what is its target, the action and response. Generally, the questions from the slides aren't as difficult as using the quick sheet models and maybe some of the other models in the room, but I would be prepared for the worst and hope for the best type of scenario. Okay? So let's look at the thyroid gland, because thyroid and parathyroid are found on the same slide. And by the way, generally, if someone wants to ask you questions about the hypothesis like this, the pituitary gland, we'll generally choose a region where you can see both sides, because just seeing the anterior pituitary when you don't have a formal histology class, to identify that as being anything other than maybe a parathyroid gland is just kind of beyond the scope of what you need to know. So generally you're going to have these two areas. You're just going to be pointing to one or to the other and then applying the question to it. The same generally will occur when we look at the thyroid and parathyroid. So let me just go down magnification. This is on scanning, where we can see an overall relationship between parathyroid glands are always to the posterior aspect of the thyroid gland. And so that's looking rather homogeneous and dark staining, kind of like the anterior pituitary. That's going to be the parathyroid gland. This is the thyroid gland. This has these repeating follicles, these tubes with material in the lumen that takes up stain. That's the T3, T4. The iodine takes up stain. Right? So thyroid, parathyroid. What is released from the parathyroid gland? Parathyroid hormone. You should know the negative feedback loop. Okay? I'm going to magnify this so we can distinguish between follicular cells and parafollicular cells. And it generally does need to be in a higher level of magnification. And again, to recognize the parathyroid gland will generally have an area such as this, where you have thyroid and parathyroid, so it's more easily distinguishable. All right, so yes, very granular. Look at all these little cells here. Here are the follicles of the thyroid gland. Ding, ding, ding. If this is thyroid, by process of elimination, this must be parathyroid. All right. Here we have a follicle. The cells that surround the lumen. The lumen is in the tube here, the inside of this passageway. These are your follicular cells. Clusters of cells outside of that, such as here. Here's a good one, here. All right, these are the parafollicular cells. All right. So follicular cells produce the T3, T4 that's taking up stain here. Parafollicular cells produce calcitonin. So again, be able to apply the negative feedback loops, of those hormones, calcitonin, T3, T4. For instance, a typical question might be, if these are the follicular cells, of course, which they are, what is the stimulus for these cells? And that would be thyroid stimulating hormone coming from the anterior pituitary. All you have to say is thyroid stimulating hormone. What is produced? T3, T4. What is the action response? Increase basal metabolic rate and metabolism. Perhaps, what are these cells? Parafollicular cells. What is the stimulus for these cells? Higher than normal blood calcium levels. What is the stimulus for these cells? Lower than normal blood calcium levels. What are the targets of the hormones produced by these cells? What would be the action, maybe the response to the hormones produced by those cells? And that's about as tough as it gets. I would be able to, while we're here, is to apply Can you see that? Apply the same to these cookie sheet model thus far. What hormone from this region targets this gland? Oh, that's the thyroid gland, so it must be thyroid stimulating hormone, and so forth. Okay, that's it.